Your future healthcare, the future of your children, your family, and your life are in your hands. Healthcare is at a crossroads because we are now threatened not only by rising costs, but also by the spreading of antimicrobials and emerging infections that threaten our existence. Traditional doctor centered care, driven by health insurance companies, has become a barrier to access, leaving millions uninsured or struggling with rising costs. Poor nations, likely to be breeding grounds for infections, do not have the infrastructure or staff to help prevent the spread of diseases. Inefficiencies, bureaucracy, and disparities in global healthcare require revolutionary change, precisely what Dr. Maya GPT is bringing to the world. Imagine a healthcare system that is affordable, automated, and universally accessible, one that ensures the poor receive medical care without barriers, while the wealthy contribute to sustaining the system. Dr. Maya's GPT is not just another AI-driven medical tool, but a game changer designed to dismantle the outdated healthcare model and replace it with a brighter, fairer, and more efficient alternative. The problem with traditional healthcare insurance is that rising premiums and administrative costs have made healthcare unaffordable for many. Millions remain uninsured due to strict policies, pre-existing conditions, or economic hardship. Medical procedures and reimbursements involve complex paperwork, slow approvals, and billing disputes. Insurance companies prioritize profits, often rejecting claims or restricting access to life-saving treatments. The poor suffer while the rich receive premium care, creating a deep gap in medical access. Dr. Maya GPT solves these problems by integrating AI automation, tier-based access, and direct payment processing to create a sustainable and equitable healthcare system. Dr. Maya GPT's 7-tier universal healthcare model. When users download the Dr. Maya GPT app, they complete a simple questionnaire about income, location, dependents, and medical history. Based on AI-driven analysis, they are categorized into one of 6 tiers, ensuring that healthcare access aligns with financial ability. 1. Unemployed and poor get free healthcare in nations, provided they implement the universal Dr. Maya healthcare system in their nation. This will reduce the number of doctors and healthcare professionals, and investment in training healthcare workers and building clinics and primary care centers. Higher-paying users will financially support Dr. Maya's GPT AI consultations, prescriptions, and limited drug delivery, and the Treasury of member nations will provide funding. 2. Low-income earners are expected to pay essential monthly or yearly subscription costs. They can also pay for basic membership when they need help from Dr. Maya's GPT doctors or specialists. 3. Dr. Maya GPT AI consultations, specialists, and discounted medications when necessary will provide essential medical services free of cost. Dr. Maya GPT will use follow-the-tailor algorithms that the decision-makers in the member nation can change. Premium subscribers can also partially subsidize these services. 4. Middle-income earners pay a standard subscription for services to their families. Dr. Maya GPT AI consultations, partial medical investigations, and doctor referrals. Self-funded, moderate subsidies from premium users can also be introduced, or users can opt for a premium subscription. 5. High-income earners' premium subscriptions pay higher premium fees to benefit from full access to consultations, hospital visits, investigations, and specialist care. Governments and companies will help fund or subsidize this because the users will be offered free healthcare. This will help employees know they have health insurance that does not have limits and duration of support. 6. Companies, corporations, and individual donors can join and receive a tax reduction offer from the government to help motivate them to donate to this worthy cause. Dr. Maya GPT will offer a high-tier contribution-based subscription, VIP medical access, concierge healthcare, and global specialist access. The healthcare offered by Dr. GPT to corporate employees will reduce staff absences due to illness, reducing the cost of employing temporary staff. Their contribution will be used directly to fund healthcare for the underprivileged. Unlike the present system, which helps senior managers of health insurance providers hoard wealth, Dr. Maya will not. The fund for health in the private bank will be released because Dr. Maya will follow the algorithms and will not delay payment. Managing committee members and staff will not have access to funds because Dr. Maya's GPT will be released after the doctors authorize. endorsed or approved by Dr. Maya GPT. 7. Government and corporate partnerships and philanthropists are offered Wealth Builder Plan, institutional level funding to provide universal health care to every nation's citizens. The leaders and decision makers must contact Dr. Srivatsa to learn more about implementing this revolutionary patient-centered care now and be prepared for the pandemic shortly. AI-driven national healthcare solutions, emergency response systems will be corporate government subsidized healthcare. 10 philanthropists who donate and support Dr. Maya GPT will be appointed as members of the managing committee decision makers to protect Dr. Maya GPT. The donations will not be used but deposited or invested to generate income that will be used to help manage Dr. Maya GPT, marketing, R&D, establishing an office, transport, and the directors, travel expenses, and pay. Some members may be invited to be the trustees of the Dr. Maya Foundation. How Dr. Maya GPT eliminates bureaucracy and redefines healthcare. Automated tier assignment and payments uses AI to determine affordability and assign a healthcare plan without human bias. Users set up direct debit payments, eliminating payment delays and disputes. Systemized medical access and direct payment processing use AI to automate consultations, drug delivery, and treatment approvals. Billing is direct, automated, and fair, removing insurance intermediaries. Dr. Maya does not allow service providers to maintain notes or bill users for the service provided. People and doctors who abuse the service will be warned and removed. AI-driven surgical and treatment decision-making. AI determines if surgery or medical procedures are necessary, reducing unnecessary operations. It removes profit-driving authorizations and other authorizations, ensuring ethical and patient-centered care. Fraud prevention and efficiency are eliminated because AI prevents fraudulent activity by analyzing medical data before approving treatments. Direct debit ensures hospitals and doctors receive timely payments. The user holds the notes of each user, and Dr. Maya authorizes access to notes only when the patient logs in using Dr. Maya's portal on the website or Dr. Maya's GPT app. They can claim or request Dr. Maya's GPT advice. Unauthorized access to medical records and abuse of personal data is prevented. This system will revolutionize access to the best medical specialists for members from all over the world. Finding the right doctor can be challenging, especially when trust, expertise, and patient-centered care are key concerns. Dr. Maya GPT eliminates these barriers by connecting patients with top specialists who uphold the highest ethical standards. Unlike traditional systems influenced by profit-driven motives, the specialists available through Dr. Maya GPT are carefully selected for their expertise, integrity, and commitment to patient well-being. Key benefits of specialist consultations on Dr. Maya GPT. The trustees choose doctors based on their credibility, contribution, knowledge and experience, ethical commitment, and merit. Specialists prioritize accurate diagnoses and necessary treatments over profit-driven care will be selected. This will help members consult with top specialists worldwide without geographical limitations. Patients can verify treatment recommendations with unbiased expert opinions. Being part of the Dr. Maya Foundation offers additional value beyond medical consultations, like cost savings and affordable care. Members receive subsidized consultations, making world-class medical advice accessible to all. Streamlined payments and direct debit ensure hassle-free access to care without financial roadblocks. Global Medical Network will connect with specialists across various fields, ensuring comprehensive healthcare. Community support and resources offers benefits from health education, wellness programs, and exclusive medical insights. Join the healthcare revolution. Accessing trusted, ethical, and highly qualified specialists with Dr. Maya GPT has never been more straightforward. Whether seeking expert opinions, ethical treatment plans, or financial benefits, the Dr. Maya Foundation redefines patient-centered care. Empower yourself with the best healthcare. Join Dr. Maya GPT today. Why insurance companies should adopt Dr. Maya's model. The insurance industry has long operated on profit-based risk assessment, often denying coverage when people need it most. Dr. Maya GPT offers a smarter, fairer alternative, benefiting both companies and policyholders. AI-driven automation reduces administrative overhead and fraud, expands access while ensuring financial sustainability, and moves from profit-driven healthcare to patient-centered financial models. It also encourages corporate and government national healthcare partnerships and scalable models for public health. Imagine a future where every person, regardless of financial status, receives healthcare, not as a privilege, but as a fundamental human right. Dr. Maya's GPT is not just another AI tool, but the blueprint for a global healthcare revolution. With its tier-based system, automated decision-making, and financial sustainability, Dr. Maya is creating an accessible, transparent, and scalable universal healthcare system, one that can be adopted by nations, corporations, and healthcare providers worldwide. Join the movement. Are you an insurance company, healthcare provider, or policymaker? Now is the time to collaborate and shape the future of global healthcare and support Dr. Katyali Srivatsa, who was named one of the first medical practitioners by Google, ChatGPT, Gemini, and DeepSeek to leverage the burgeoning power of the internet for patient-centered care. He developed early programs on personal digital assistants, PDAs, to empower junior doctors to diagnose and reduce child hospitalization, and also master clinical acumen. His work is copyright and design protected, and so cannot be used or implemented by anyone for more than 70 years. Thank you for listening, sharing, and supporting our vision to create the Dr. Maya Foundation. We want to ensure that future generations spend more time with family and friends, not waste time thinking or worrying about health, and be happy.